Mrs. Jones. My name's Tiffany. I'm going to be your student nurse, and I'm going to be inserting a Foley, okay? All right. If you don't mind, will you please state your name and date of birth for me? Okay. All right. I'm going to shut this curtain. Normally, we'd go all the way around, and I would also shut that curtain to maintain patient privacy. For the sake of the video, I will leave it open. All right. I'm just going to lift the head of your bed, okay? Alrighty. Alright, is that comfortable? Okay. I'm going to wash my hands. And I'm actually going to put on clean gloves. Alright. I'm just going to pull these covers back, okay? So I'm going to pull the covers back. I'm going to adjust the patient's legs. Alright. Are you comfortable? Okay, good. I'm going to expose the patient by pulling up their gown. Alright, and now would be a time if they had a brief or if they needed to be clean, I would do so since I have my clean gloves on. Alright, I'm going to dispose of my gloves. And I have already gotten my catheter kit. So what I'm going to do is I'm going to open it, making sure I touch this 1-inch border. And I'm going to open the farthest side away first, then the sides, then the one closest to me to make sure that I remain sterile. Alright, I'm going to take my gloves out. I'll lay them on the table. And then I'm going to take this, and making sure I touch this 1-inch border. I'm going to remove it and make sure that the shiny side is face down and lay it underneath the patient. Okay, so now I'm going to put on my sterile gloves. I'm going to open it, making sure I touch this 1-inch border and out the table. Alright, I'm going to grab the inside of this and slip it on my hand. Making sure I grab the inside. I'm going to take this other hand, now that this hand is sterile, and put it on the other hand. Okay. And then adjust it. Okay. Now that I'm sterile, I can touch the contents that are on the inside of the box. So I'm going to take this, and I'm going to throw it away. I'm going to take these two out. This is what I'm going to use to clean her. I'm going to put them to the side for right now. I'm going to go and take this out. And I'm just going to put this to the side and make sure that none of this touches that 1-inch border. Okay. So first, I'm going to take this. I'm going to turn this around. I'm going to take, open my lube, pour it in here, throw the contents away. I'm going to take my cleaning Q-tips and open both of them and keep them within reach because I'll be using them in a second. Okay. Over here. Okay. And I'm going to go ahead and I'm going to take my catheter and I'm going to go ahead and dip it into the lubricant and attach the syringe. Throw away the cap and attach the syringe to the Foley. Make sure it's in. Okay. So now what I'm going to do is I'm going to clean her. I'm going to take one of the Q-tips. I'm going to clean the outside from front to back, throw away, grab another swab, clean the other side front to back, throw away, grab one more, and clean straight down the middle, front to back, and then throw it away. So now since I've contaminated this hand, I'm going to take this hand. I'm going to grab my catheter. I'm going to take the tip and I'm going to insert it until I get urine.
You have urine?
So now that I have urine, I'm going to go ahead and insert it just a little bit more. And then I'm going to go and inflate the balloon. Then I'm going to grab a hold of it and give it a little tug to make sure that it is in there snug. All right, I'm going to go and I'm going to remove the syringe, and I can discard of that now. I'm going to take the catheter. I would attach it to the patient's thigh and then attach the bag to the frame of the bed. And if I wanted to take a specimen collection, I could do so at this time. Then I can go cover the patient back up and position them after I have thrown away all my materials. I'm going to take off my gloves, perform hand hygiene, help the patient get positioned, cover them back up, and I'm going to lower the bed all the way back down for patient safety. And then I would keep the head of the bed lifted, or I could put it down based on the patient preference. And open the privacy curtains. Make sure their call light is within reach. Do you have any more questions, or is there anything else I can help you with? Okay, and then I would wash my hands.